My name's Emma, and I'm one of the nurses at Noah's Ark Children's Hospice, and I'm here today to talk to you about the world of paediatric hospices. So feel free to ask any questions at any time. It's very strange not talking to real people. Well, I know you're real people, not being able to see you. Can people hear me? I hope so. And so I'm going to start. So, welcome. I've been asked to have these slides as well, just to remind you to do some feedback at the end, which really helps improve and enhance these kind of programs. So here we go. Or not. Let's see if we can get the next slide. There we go. So as I said, my name is Emma. I've worked at Noah's Ark Children's Hospice for nearly 4 years now. Prior to that, I was a nurse at Great Ormond Street Hospital for the best part of 20 years. So my background is really hospital nursing, and the world of the hospice is still very new to me, and I'm learning every single day. But it's fantastic, and it's worth the learning. And again, let's get the next slide. There we go. So who is Noah's Ark Children's Hospice? We are a hospice, and we will have children referred to us who have life-limiting or life-threatening conditions, which are based on the National Children's Hospice criteria. So there are 4 groups in the criteria. Life-threatening conditions for which curative treatment might fail, such as cancer or organ failure. Conditions where premature death is anticipated, but intensive treatment might prolong life, such as complex cystic fibrosis is an example, or HIV. Group 3 is progressive conditions without curative treatment options, where treatment is exclusively palliative, such as batons or mucopolysaccharidosis. Group 4, conditions causing severe neurological disability, leading to susceptibility and health complications and likelihood of premature death, such as severe cerebral palsy or multi-disabilities. We have quite a lot of cerebral palsy is a tricky one, because obviously there's lots of children with cerebral palsy who are fine, and their life is a lot less limited or threatened as the children that are referred to us. So we do ask for quite a lot more details with children that are just sent to us with a diagnosis of cerebral palsy. But a lot of our children maybe have intractable epilepsy, and that's one that would definitely come under our criteria. We were, when I first did this presentation, just a community-based hospice, but now we have an inpatient unit too. So I'll come into more details, excuse me, about how that all works in a following slide. We are a charity. All paediatric hospices, as far as I'm aware, are charities. So we rely on donations. We rely on a small amount of government money, but effectively we are funded by donations. We are all about the family, and we're all about what does the family need and what can we do for them. We do tell them what we can offer, but it's not a question of them fitting into what we can offer. It's a question of them saying what they want, and we will do our absolute best to try and make that happen. We have fantastic therapist teams, so we have music therapy, drama and movement therapy, and we have a play specialist. And then we've had some therapy students recently, so we've had an art therapist for a short while added into the mix, which was brilliant. The families are able to access the therapies. It's not just the children that are referred to us, it's their siblings as well, and extended family, and we can really see the benefits of that. And our music therapist is been doing some specialised training with neonates too. And we have good links with Great Ormond Street NICU and Barnet Neonatal Unit. And then post-death care. So we provide post-death care both in the community and here in the Ark. So we have 2 butterfly suites, what we call our butterfly suites, here in the Ark, or cold rooms, as you may know them. And we have cold blankets, and they're really good at preserving the body. People ask me, how long can we keep a body for? We can just wait and see. We just tell the families that we'll reassess it each day, and it depends how things are deteriorating. But we can also take the cold blankets out to the community. So if a family would like to keep their child at home post-death, we can do that. And we're just about to instigate some training for local community teams so that we don't have to be in the family house 24/7 with that. And then post-death, we also have a very strong bereavement service provision, which is run by our family link team, which I will come to later. And any child that dies with us, the family can remain with our services for 3 years, so the siblings can carry on with the sibling groups, and there's lots of post-death groups and meeting. They can come to the ARC and use the services as they feel they need to. And that goes for someone who wasn't referred to us beforehand as well. So if somebody dies and then we deal with them immediately post-death, for example, with the cold blanket, then again, they're able to access our services for another 3 years. We have babies, children and young people, and they can stay with us up until their 19th birthday. Our boroughs that we cover at the moment are Camden, Islington, Hertfordshire, Barnet, Enfield and Haringey. Whilst one of the other hospices, Shooting Star Chase, has closed one of its sites, we're actually also extending out in their area, which covers kind of Hayes and Hillingdon and out in that where more north. And Hertfordshire, we're just the bottom part of Hertfordshire, so West Hertfordshire we cover. Any questions? Just as I said, feel free to ask. So I just thought that this is a slide to tell you who the team's made up of. So there's nurses like me, and we have all levels of nurses, 5, 6 and 7s, and we provide training, we provide management and support for our specialist carers. We're all developing our end-of-life skills, and when we first started, we would just go out to the community and support all the community teams with the end of life, but obviously now we're taking them, children who are end of life, into the ARC. We have a fantastic team of specialist carers, and prior to opening the ARC and prior to COVID, the specialist carers were providing 3-hour or more short breaks in the actual home. So they're fantastically skilled, and we have specialist carers who are able to look after track event children on their own, and then that means the families get a break. The specialist carer can go to the home and the families can go out knowing that they're leaving their child with someone who's competent in their care. And they may stay in the home, or they may take them out to the park, or they may take them to nursery school if that's what the family would like us to do, because sometimes it's very difficult for them to get carers who can take their children to school, or schools to accept children with these complex needs. Like I mentioned before, we have our therapist team, music, drama and play, and then our family link team. Our family link team are massively important. They are the first port of call. So once a child is referred to us and we've accepted the referral, the family link team will make contact. They're like a social work team. There are social workers in the team, and they will meet the family, they will find out all their needs, and they will tell them about all the different services that we provide, and they'll give the family some indication of the services that they think might suit them best as well, and then they'll bring them back to a big group meeting that we have every 2 weeks. If they are suggested that they need specialist care service, then one of the nurses will go out and do an assessment with the families. That's how it works in the community. And in the ARC, we're still getting referrals and we're still treating them the same, but obviously children are coming now to stay in the ARC, sometimes for end of life, sometimes for post-death, sometimes for respite, but I will come to that on the next slide. And then the other part of the team are our family activities team and our volunteer services. So obviously as a charity, we can't manage without volunteers, but we have family volunteers. So we have family home volunteers who will go into the home, and they may do ironing, they can do gardening, they can drive families to appointments, but we also have volunteers who work directly with the families. So they may have a sibling that they'll help do homework. That's one of the big things that they do in the homes. They will also work with a Noah's Ark child, but a volunteer is never allowed to be left alone with a referred child. But with the siblings, they can take them out, take them to the cinema, do the homework, play games. Sometimes the siblings, it's very difficult for family to to take the siblings out or to do things with them. So the volunteers are really, they have really special relationships that we've seen, which is great. And then the family activities team are part of our team who do what it says on the tin. So they arrange activities for everybody in the family. So where they have sibling groups of all different ages, and they meet regularly with them and provide activities. You can see in some of the pictures that that's examples of what we do. And we're also the first organisation to organise group activities for the actual referred children. So all our children, whatever their needs, whatever their disability is or their complex needs, they are divided into groups too, and we do special events with them. So most of the photos, if you can see around the slide, they are from the referred children's days. In the top left-hand corner to me, that's been an activity in the Ark. So once we had the building open, we were able to access all the things that we've got here. So that's a little boy having, well, you can see bubbles blowing at him. The top middle that was a day, I think it's at Arsenal Tottenham ground. So obviously Tottenham Hotspur is our big supporter, but I think on this occasion they went to Arsenal. And there are bikes, and there were bikes you can see in the bottom middle that we can put the wheelchairs onto, and then they were cycled around. Oh no, that is nice. They were cycled around by the specialist carers. We've been to Legoland. Left middle, we've been ice skating, and though you can't see it, that's actually me pushing the wheelchair on the rink to stop me falling over. We've taken children ice skating, we've taken them to Legoland, we've been bowling. With the younger children, we've been able to access soft play areas. So yeah, and it's great. And sometimes that's the first time the child has ever been out anywhere without a member of their family. So it's really special. It's their time, and it's their time to learn new skills and feel independent, and it's great. Top right are the siblings, actually, the sisters of the little boy on the top left, and that's a day out in Legoland. I don't think that's a family day. I think that was a special treat. So we get donated all kinds of things, and families are able to access treats and things. I think that was one of them. Bottom right is a family day. So Willow's Farm, which is not far away from us, we arranged a family day. So that's obviously a day for all the family to be together, and we have a big Christmas party, and we have a big summer day, and we have a sports day, and yeah, it's all a lot of fun. So it's all about the living as much as possible, and not about the dying. So this is what the building looks like. So we moved into the building on the 1st of July last year, and we were using it then just for the office space. And then we started taking children into the inpatient unit in April. So just as COVID hit, that was when we started taking children to the Ark, and we basically hit the ground running. So it's shaped like a butterfly. So a butterfly is our theme. It's on a lot of our documentation, and the butterfly suites are our post-death care suites. So you can see I think you can see the top of the building, that's the inpatient unit. And on that right-hand side, there are 2 floors, and on the left-hand side, there's just 1 floor. So the back right is the inpatient unit upstairs, and downstairs we have multi-purpose rooms. We have a jacuzzi down there. Doesn't have a jacuzzi in it yet, but that's what it's going to be for. And we have a big laundry. We have a quiet multi-faith room, which is beautiful with stained glass windows. I wish I could take you down there and show you. With the butterfly suites, we have the actual cold room where the child will stay, and then opposite it, there's rooms for the families to stay in. Excuse me. We have meeting rooms down there, and yeah, that's what's downstairs. And then on the other part, so in the front right, is the family wing. So upstairs in the family wing, there's 3 big family suites, all with a kind of double bed in one area, and then there's they're all different shapes and sizes, but they all have small rooms where there's bunk bed for siblings, another one there's 2 single beds for siblings, and then the rooms have a varying degree of catering supplies and equipment. One's got a hob, they've all got kettles and microwaves, so the families can have as much space as they need to be on their own. But we also have a big family kitchen where people can cook. We have a full-on oven and hob and microwave and everything, so they can cook properly. The very first child we had in the Ark was a post-death child care. She died on Christmas Eve, and on Christmas Day, family friends came in and managed to cook the family a proper Christmas dinner. So we know it works, and that was really lovely. And then on the left-hand side, you can see we've got the reception and offices. And then the back, I'm not sure if you can see, just at the back where it says facilities for all, that's our playground. So we have a play area, we have a seesaw that's designed for wheelchairs, we have a swing that's designed for wheelchairs, we have a trampoline which wheelchairs can go on. Just be careful you don't go when it's raining, because if you jump down, water splashes up. I know from experience. And then along that wing, that's where we have our den. So we've got a big cinema room, which can be used also just for chilling out and relaxing in. We have a soft play area with another trampoline and a great ball pool. We have a sensory room, which is stunning and has got everything that you could think of, including a lovely waterbed, which we can play music through, which is great for our children with, lots of sensory deficits. Creative room, yeah, soft play, and we use those. We use them a lot. We use them a lot. And pre-COVID, we were having after-school groups, like a drop-in centre, drop-in time for children to come and use all those things. And yeah, it was really successful and it was lovely, and people were using them, but then sadly COVID hit. The other thing we have in the inpatient unit, we've got 3 all singing, all dancing baths. They're big, they're height adjustable, they have jacuzzi feature, and they have lights and music. And some of our children aren't able to have a bath at home. They barely have a walk-in shower that they can access properly. And so we've opened that up, and we have what we call bath and splash sessions. And for some of our, especially some of our bigger boys with cerebral palsy, who are often kind of a bit cramped in their chairs and home's not very big necessarily, and they have an opportunity and to come and chill out in the bath, and that also has been very, very popular. We don't have any doctors on site. We have no medical team on site. So I guess we have certain restrictions onto what we will accept, but not too many. Recently, we've had 4 end-of-life children. We've accepted children with a PICC line. We manage syringe drivers, and we manage symptoms. We work very closely with the GOSH symptom management team, and generally a lot of the children have been referred to us through them. And so we have their symptom management plans, and we liaise with them as and when we feel we need to administer something. We're also working towards an SLA with Barnet Hospital. The paediatric consultant there is very keen to work with us. Obviously, being based in Barnet, we have a lot of children who come from Barnet, a lot of children that the team there already know. So we're looking towards an SLA that will cover pharmacy, will cover clinical cover, medical cover, infection control, and some training as well, which is brilliant. I think I'm going to move on to the next slide. I could talk forever, so feel free just to ask any questions. Like I said, moving in day was July the 1st. Whilst we're in the Ark, we're still working on our community services, so we still provide respite in the community, and that's so important, because a lot of our families don't need to come into the Ark, and for them to have a 3-hour break every week is just what they need. And we've developed really good relationships with a lot of our families, and they have really missed us during COVID. We're also partnering with other community teams, like I said, to provide end-of-life care. So all the community teams in the boroughs that are in our catchment area, we're working with them and to enhance the end-of-life care that any of these children can have. We have a family reported outcome measure system that the Family Link team work with, and obviously they ask families how they feel and things are going, and what they're getting from us and how it's working for them, and then obviously that we get that reported back to us, and we try and increase and improve our services related on what the families have asked for. So the hub of the Ark, the building, is the family activities, as I explained before. Clinical team, so one of the consultants at Great Ormond Street now has a clinic here. She doesn't physically come into the building for the clinic. We go with her out into the community, but if she ever wants to use the clinic as the ARC building as a base, then that will be arranged. Butterfly groups, so that they're the post-bereavement groups that families can access. And we have very different ones for those. So we have ones for grandparents, we have ones for parents, we have some just for dads, some just for mums, because that's what the families have asked for, and different people obviously find it easier to speak in different types of groups. So we manage that too. It will be used as a drop-in centre once we're able to do that in terms of social distancing. We had some lovely volunteers ready with their cupcakes to provide like a little cafe for all. And then the other rooms I've already mentioned, but the idea is that these will be accessible pretty much at any time that a family requests that they would like to use them. As we come out of the worst of COVID, we hope, we have started reopening all these areas, and we have offered out, we can have one family in the morning and one in the afternoon because everything gets cleaned in between, and families are booking in to come into the ARC and use the soft play, the sensory room, and the outdoor space, and it's being used a lot, and I think families, it's a bit of a relief to get out of the home, as it has been for all of us. And then, so like I said, we don't have clinical care, but what we do is obviously we have the therapies, which I mentioned before. We will also take children as a step down from hospital. So we've got a child who's going in for a spinal fusion whenever the family feel ready for it. And obviously that can be a long, long stay in hospital. But once he's stable and all his drains and everything has come out, he would be able to come and stay with us for the family to get used to him and him to be able to stay here. So that's definitely in the pipeline for him. We've had another step down of a quite small baby who, when they were in hospital, they had an apnea, which very frightened mum quite a lot. So she just didn't feel quite ready to go home on her own. So they came and they spent some time with us, and they've been back a few times for respite, and which is great. They've come to us and they've found us useful. End of life, like I said, we carry out end of life care. We're a hospice, so we've had about 4 or 5 recently since COVID hit. Not COVID related, just so happens, because a lot of other hospices closed down during COVID, and we stayed open. So that's been our remit largely for the past few months. We've had quite a lot of teenagers, and often they're very reluctant to come to us at first, but we just invite them to come and have a look around and talk to them about what they think it might be like and what we can have, and usually they end up happy to come with us. Our first end of life, he had 8 siblings, and we had the whole family staying here for the whole time, and it went as well as it could, I would say. We also will help try and accommodate families for social crises. We had one mum who got cellulitis in her foot, and she has 2 disabled children, one who's a referred child to nurse ARC and one who's a sibling, but she has her own disabilities. And so the whole family moved in. The whole family moved in, they stayed in the family wing, and we did the care that was required of us, and mum was able to put her foot up on the bed and take a week to recuperate, and then go. And that was particularly lovely, because she's a child that's been with us since Noah's Ark started, and they live locally, and they've just been waiting for something like this and for the Ark to be open. So it was really special that we were able to do that for them. And then clinical crises. We've just recently had a child in who did have COVID, and he's been very, very unwell, and he's clear now, but he's been left with severe abdominal pain, and it doesn't sleep well at night, and the family have just been finding that really hard to cope with. So he came in for a couple of nights to give them a bit of respite and get them fresh, ready to tackle the weeks ahead. The other rooms on here I've already mentioned. So COVID-19, I couldn't really do the presentation without mentioning that. I know we're all probably a bit sick of it, but it's still there and we have to deal with it. So our face-to-face community services were put on hold at the start. There was nothing we could do about that. And that's, like I said, we then opened the ARC, hit the ground running, and we've tried to do as much as we can with children in the ARC. Lots of families haven't wanted to come initially in the first few months, but now that's gradually, they're willing to put their foot out the door and needing it. The inpatient unit opened fully, as fully as we could, considering our staffing. A lot of non-care staff were furloughed, so a lot of the care staff were taking on non-care roles. Now an expert in recruitment. Obviously, being a charity, we were hit very significantly in terms of funding, but we have an amazing fundraising team, and those of them that weren't furloughed have worked incredibly hard, which has been fantastic, because it has meant that the children that have been end of life, that have needed our care, we have been able to provide it, and that's really, really special. And then Zoom. Who doesn't love a good Zoom meeting? But our family activity team, particularly, and our therapist team, have used Zoom to the full, like just to the hilt, and they've been doing loads and loads of sessions, one-to-one or group sessions. We had our family activities recently sent out cake making packets to a group of siblings, and then they did the session together via Zoom. So one of the family activities team was here in our kitchen making the cakes, and all the siblings were doing it. I think they were M&M chocolate cookies, actually, not cakes. And then all the children that joined were doing it in their own kitchens, and it sounded like they were having lots and lots of fun. And children now also accessing, so we have one child who we were providing 3-hour care in the community respite once a month, and at the moment he is now coming into the ARC for those 3 hours. He's coming most Saturdays, him and his best friend, and they have music therapy together sometimes, and then they'll do a bit of cooking or anything else that they feel like doing. And it's lovely because they've not been able to go to school, they've not seen each other very much, and now they've been able to reconnect with the ARC. So where are we now? So family activities were furloughed for a long time, but now they're back in the ARC, and they're back planning all the activities that they can, and working out how we can do those in this almost hopefully post-COVID world. Like I said, that they were doing the cooking the other day. We've had a massive restructure in terms of staffing in order to manage our services more coherently, I think. So COVID has also been a good time for everybody to sit back and look at what works and what doesn't work. Our community services the plan is to start those on the 1st of October. And whereas before we would offer 3-hour breaks, and a specialist carer may see up to 3 families in a day, we're reducing that to one 5-hour respite session a day for each carer, just to try and avoid any cross-infection. But we're still offering families the same in-house respite. And as I said, we're supporting other hospices. So where other hospices are closed, we are their children are being referred to us, and if we're able to help them, then that's what we will do. And we are employing lots of new care staff. So that's the area that is growing, because we want to be fully open in the building and in the community, and to be carrying on offering all the services that we have done, and more, and whatever it is the family needs. That's always our goal, is to do what it is that the family needs. And that's all from me. Half an hour. I don't know if anyone's got any questions. I hope that's helped you understand what it is that we do, and at the end of the day, we will do everything that we can and anything we can. And yeah, if anyone wants to ever come and have a look, please do. We love showing people around. And oh, look.
Thank you, Emma. That was just really great. It was really helpful, like just amazing to see what the ARC is like, and just to hear the services that you guys provide. It's amazing work that you guys do.
Yeah.
Has anyone got...
Sorry, I know a lot of doctors often don't know exactly what we do, and it does. People often think it's all about the syringe drivers and the end of life, but yeah, there's a lot more to it than that. Yeah.
Exactly, and I think that just knowing people in the future will just know how to refer appropriately, and be able to just know exactly what a hospice provides, which is just really, really helpful. And I've had the opportunity not to visit Noah's Ark, but a different hospice, and it absolutely opened my eyes. So I would really suggest to anyone who's interested to just go and see one. And it's so peaceful and wonderful. They're lovely places to just go to.
Yeah, I wish I could show you around. I did think about it, actually. I did think about doing this on my iPad and then taking you around, but another time, I think.
Right. If anyone has any questions, then Emma can can be here to answer. But if not, then we just want to say thank you, Emma, for doing this for us on a Friday evening.
Yeah, that's my pleasure. At least somebody turned up, so that's good. Thanks for turning up.
You're welcome. So if anyone doesn't have any questions, then yeah, we'll just say thank you. Have a lovely evening and have a lovely bank holiday week.
Yeah, you too.
Okay, thank you.
Thank you. Thanks for inviting us.